In a surprising turn of events, an unusual coalition of both Republicans and Democrats in the U.S. Congress is rallying together to tackle the impending expiration of Obamacare health tax credits. This initiative comes just as the deadline for government funding looms on September 30th, and it could have significant implications for millions of Americans. This bipartisan effort not only provides Senate Democrats with a potential victory to showcase to their constituents, but it also offers President Donald Trump's party a chance to avert the expiration of a widely appreciated benefit as the midterm elections approach. The urgency of this situation is underscored by the fact that over 24 million Americans currently rely on these tax credits to afford their healthcare coverage through the marketplace. Republican Representative Jen Kiggans, a nurse practitioner from Virginia, expressed her concern, stating, "Families getting notice in about 6 weeks that their healthcare premiums are going to go up at the end of the year is not the right direction." Kiggans, along with 11 other Republican colleagues, is advocating for a 1-year extension of these crucial subsidies. These expiring tax credits were initially enacted by former Democratic President Joe Biden in 2022 during the pandemic, which expanded eligibility and capped out-of-pocket premiums for benchmark plans under the Affordable Care Act, ACA, at 8.5% of an individual's income. If Congress does not take action, healthcare premiums in the ACA marketplace could see an alarming average increase of 18% next year, according to the healthcare nonprofit KFF. Interestingly, while the ACA was initially criticized by Republicans as Obamacare when it was introduced in 2010, the landscape has shifted. Now, some Republicans are cautioning that failing to resolve this healthcare tax issue could alienate their voter base and be perceived as a tax increase. However, the party's leadership has yet to reach a consensus on a viable solution. Various advocacy groups, ranging from the conservative Americans for a Balanced Budget to the American Medical Association, have been vocal in their support for extending these tax credits. Kiggans, along with many House Republicans advocating for a resolution, represents some of the most competitive districts as the 2026 midterm elections approach, according to nonpartisan analysts. Kiggans remarked, "I struggle with Republicans sometimes not being in the arena with healthcare issues, and this is a no-brainer for me. Yet there are conservatives who express concerns about the program's financial implications, with the nonpartisan Congressional Budget Office estimating the cost at around $380 billion. To pass government funding, Senate Democrats' votes are essential due to the 60-vote requirement for most legislation in the chamber. While Democratic leaders are acknowledging healthcare concerns, they have not yet made a strong public push to include the expiring tax credits in the government funding discussions. Senate Minority Leader Chuck Schumer highlighted the urgency of the situation, stating, "The American people are hurting because of how they've decimated healthcare. We need a bipartisan negotiation to undo that damage." He emphasized the need for immediate action, saying, "We need to extend these tax breaks as soon as possible." Democratic Senator Tammy Baldwin of Wisconsin echoed this sentiment, urging for a solution in the upcoming stopgap government funding bill, noting, "With families already being squeezed by high prices, this is the last thing they need." As this situation unfolds, it raises important questions about the future of healthcare in America. Will Congress come together to protect these vital tax credits, or will partisan divides hinder progress? What are your thoughts on the potential impact of these tax credits on American families? We invite you to share your opinions in the comments below.